As we look back over 2021, the fight against COVID-19 has continued to dominate headlines. Today, we take a look back at how the fight against COVID-19 happened right here in our local cities. It's hard to remember back to the beginning of 2021 when vaccines were hard to come by.
This is one of 9 sites across the state where people age 65 and older who are lucky enough to snag an appointment will get the first dose of the COVID-19 vaccination.
At-risk seniors and first responders were among the first to roll up their sleeves. Wayzata High School was in distance learning and became a makeshift vaccine clinic.
We wanted to see what it looks like where we're vaccinating. And this is for those first responders who are in direct contact with folks with health issues.
A month later, vaccine clinics were opening on a much larger scale, like in the old Target building in Brooklyn Center, with emphasis still on high-risk groups.
Relief. It's been very trying on everybody around.
But by the spring, reports started showing disproportionate COVID-19 mortality rates in some groups.
A lot of members in the Hmong and Korean community, they also live in multi-generational households. And so it's not just mom and dad and baby or a son living in one household. There might be grandma, grandpa, aunt, uncle, niece, nephews living in the same household. And so if one person gets exposed and they come back home, multiple people can also be exposed to COVID-19 as well, too.
Efforts also began to focus on getting those marginalized communities vaccinated through measures like this one. A Brooklyn Center mosque held a vaccine clinic to coincide with Ramadan.
So there is hesitancy here. There's no question about that. But that's why I have always advocated, in order for us to be able to administer the vaccine in the way that we want, we need education.
As spring turned to summer, vaccinations opened to people as young as 12.
There's a shift. We're now seeing that more of our students, especially our adolescents, are testing positive. And so because of that, there's a very much demand for vaccinations in this age group.
Then there was a new threat, the Delta variant.
I wouldn't wish this Delta virus on my worst enemy. It's serious. They're coming in very sick.
The variant led to a surge in cases in local hospitals and a concern about breakthrough cases or cases among people who are vaccinated.
The breakthrough cases that we are seeing tend to be in people that are older or maybe under some sort of immunosuppressant therapy like chemotherapy.
In an effort to get more people vaccinated, we started to see more incentives and more outreach, like mobile vaccine clinics. Schools got back in session, with most in masks, and some school districts increasing COVID testing, all to keep students back in in-person learning.
We feel strongly about helping really reduce cases by catching either symptomatic students or students or staff that may not be symptomatic, but that we can really prevent spread in by catching.
But as the year went on, hospitals, clinics, and long-term care facilities were hurting because of staff burnout.
They're just leaving. They're just leaving because they don't want to do it anymore. They want to change jobs. They want to change positions so that they no longer have the stress on them.
North Memorial held job fairs, and the governor called up the Minnesota National Guard to help assist long-term care facilities like Northridge Health in New Hope. By the fall, vaccines and boosters were readily available, and vaccine clinics started to be offered to students as young as age 5. Now in December, North Memorial and Maple Grove hospitals are once again at capacity.
We're poised in Minnesota to have the most COVID patients we've ever had since the beginning of the pandemic after this holiday season. That's a recipe for disaster. We only have so much resource, and it's dwindling.
Find more local news stories at ccxmedia.org and follow us on social media.